And after I name drop Dr. Brian Childs, he will come and introduce our next speaker.
Come on up, Bernie. I'm Brian Childs, and it's my distinct honor to introduce to you Dr. Bernard Scoggins, Bernie. I don't think I've told you this, Bernie, but I admire you, and you were my hero for a couple of years. I first got to know Bernie because we're both on the board of directors of the Georgia Healthcare Ethics Committee Consortium. And at the height of COVID, we had these Zoom meetings, and Bernie was in ground zero of COVID in this country, in Albany, Georgia. And he was at Phoebe Putnam, and he would talk to us and tell us what it was like ministering as a physician to the people who we didn't understand this disease and how to treat it. And I don't know how many hours you spent up at night caring for those patients, and I would say ministering to those patients in those really terrible early years of COVID in this country. Bernie's a graduate. He's from Dalton up north in Georgia. He's a graduate of Davidson College, Duke Medical School, and he did his training at Emory University. He's had a number of positions, including chief of staff at Putney, and he also was a recipient he was the Health Care Ethics Hero of the Year in 2007. And that honor was bestowed upon him by the Ethic Consortium at Emory. So it's my pleasure to introduce to you Dr. Bernard Scoggins. Bern.
Well, thank you. First, I want to express my empathy and sympathy for people who had Hurricane Helene come across their cities. Albany, Georgia, 6 years ago, October, Hurricane Michael came right through Albany. It was only Category 2, but still caused damage, lights out, power out for weeks. I can't imagine a Hurricane 3 or 4 coming through. I got friends from college, from Davidson, who live outside Marshall, which is outside Asheville, and the French Broad River, which I've hiked past, just overflowed all through Asheville, through Marshall, tore up Asheville, and Marshall is only a city of 800 people. Just wiped out that town. So it's been a horrible experience for all of them. And now people on the coast are just now getting back power through homes and schools and things just after a week or two of having no power at all. But I was tasked this morning to talk about Medical and Faith Collaborative and faith in rural health care. Now, I've been in Albany for 45 years, so I grew up in Dalton, which is a small town. Left Emory in '79, came to Albany. Came there partly because when I was an intern at Emory, my resident at Grady Hospital first year was a junior resident, James Hotz, who became Doc Hollywood. The book's written about him. Neil Schulman, who was an internist professor at Emory, wrote a book, and a movie, of course, was based on it, with Michael J. Fox being like Dr. Hotz, basically. But the movie and the book kind of went well beyond what he did. But we were best friends. You work when you're in the hospital at Grady, and in those days, hate to say the old days, but you know, we stayed up all night long, worked 36 hours straight sometimes, go home, come out the next day, a couple days in the hospital, next time 36 hours again. You get to know somebody pretty well. So taking care of sick people at Grady Hospital, Emory, and the VA. So I've been friends with Jim Hotz, and he got me to come down to Albany, join him and his brother-in-law in summer of '79. So I think I can speak about the trenches of healthcare. When I went to Albany in summer of '79, there had been no clinicians in Lee County for decades and decades. Lee County is just north of Dougherty County. We started our first practice here in February '79. There have been no physicians, no clinicians in Baker County. Baker County is just south of Dougherty County. It's been 50 years since he had a doctor down there. We started our second clinic down there in November '79. And back then, the governor of Georgia was Busby, who was from Albany. He came down and helped us dedicate our clinic down there. We're the first clinic, may still be the only one, with mental health, public health, medical health, all in the same building. It's still there. A county of about 4,000 people. So I know it sort of from the trenches to start with there. We also started the first HIV clinic in South Georgia, got a grant, and it's now the largest rural health HIV clinic in the country. We have 2 sites in Albany and in Thomasville. Speaking about the collaborative, I'll get to a lot of things about that, but I want to give you some of my personal history, how I got to this point too. And I think we realized, and why you started this whole program, is to have faith that rural health care will still be here. Faith in rural health getting together, but also even be here together. The last 10 to 15 years, hospitals in Ashburn, Cuthbert, Arlington, Dawson, Fort Gaines, all those hospitals have closed down. And they're not going to come back as a full-service hospital. Now, John Ossoff is working with people in Cuthbert to try to bring back some sort of health care in Cuthbert, whether it's a urgent center, overnight stay. Right now, that whole community does not have a full-time EMT paramedic. They have to come from another hospital into Cuthbert, transport them probably to Albany. You can imagine what happens. It takes 45 minutes to an hour to get to somewhere. So they're trying to work with them to establish health care again. But all those hospitals have lost health care. But I really believe because of health centers like ours and what Mercer's is doing, I think the health center out of Americus had a health center in Plains, Georgia, which they closed down, but I understand that Mercer went into Plains, Georgia, Jimmy Carter's hometown, and started a health center in Plains. Mercer's reaching out now the last years, stressing this whole thing about rural health care. So I think we're seeing that more and more, and I do have faith that rural health care will be here. But winter of 2020, we heard rumors that something was going to happen. There have been rumors from my decades of working. The MERS virus was another kind of coronavirus about 20 years ago, Middle Eastern respiratory virus. It may spread around the world, may come to Albany, Georgia, never happened, of course. Swine flu epidemic, 2009. They geared up a special vaccine for it, never came around. But of course, we also remember AIDS. I was in Albany when the first AIDS cases were described. The virus was described, well, clinical illness described in '81. About 3 or 4 years later, they identified the virus, the retrovirus. So things can happen, and AIDS turned out to be a huge, tremendous, unfortunate disease in our country, which is finally being much better controlled. But we heard there's rumors. The Wuhan virus in China. Now, China's a long ways away. There are all kind of rumors what was happening. Is it going to come here, not come here? But our hospital started doing preparations. Now, Phoebe Putney Hospital is just a few blocks from downtown. Turns out I'm on the board, on their health board of health. I didn't know that they had a warehouse downtown filled with N95 masks, with gloves, with gowns. Unfortunately, not filled enough. Nobody would have thought about this. They started searching even before March of 2020 to find more masks, more gloves, more gowns, more of everything. Of course, everybody else started searching too, so the price, of course, went up and up and up and up like this. Supply went down like that. Huge, huge costs. Our health center also started looking at what's going to happen to us. We wanted to stay open. We had limited supply of N95 masks, very limited compared to the hospital. We had to research for N95 masks, lots more gloves, gowns, everything also. But we started getting ready in February of 2020 for what was going to come, if it did come. It just happens the first weekend in March, Albany always has a marathon and half marathon. And the marathon is rated, if you finish it certain times you can qualify for the Boston Marathon. So we get people from all over the eastern part of the country coming to Albany because it's a very flat course. I've been to Albany, it's very flat. I grew up in Dalton, like Rome, it's hilly mountains. Albany is flat. That's been the hardest thing I've had to deal with, okay? I love to go hiking. We have trails through swamps, not hills. I just left Yosemite National Park 2 weeks ago, from Yosemite back to Albany. I love Albany, but it's flat, okay? It's not Yosemite. But they can qualify. I always run the half marathon. I ran 2 marathons, one in medical school, one later, and it cured me of that. I'm going to ruin my tennis. I love to play tennis. I'm going to ruin my tennis running marathons. But I did run a half marathon. My goal was to run one every year until I turned 70. So in March 2020, I was turning 70. When I run my last half marathon, then I'd cut back to maybe a 5K, 10K. So I was lined up with 1,300 other people across the eastern part of the country, lined up out there. And at the convention, I thought, is this a good idea? This is the first weekend in March. Of course, nobody's wearing masks. We're all having a good time. They play music, music, music. Somebody says a prayer over us, which I appreciate. I just wanted to finish. So we get a prayer. Nobody's ever died from the marathon. Nobody's ever collapsed from it. Have some wounded warriors, but nobody ever died from it. But I went home thinking, I hope this is not going to be written up in the CDC's manual about how COVID spread to Albany because of a marathon. Well, that did not happen, but other things did happen. Now we have some students here, other people here. I want to, from a personal story, go back a little bit, in fact, way back to my personal story as a clinician. I actually spoke at Tatnall Square Baptist Church, which I believe is north of the campus here, between here and downtown, back in spring of 1968. I grew up in the First Baptist Church in Dalton, Georgia, and we, at that time, were coming of age, you might say. The sexual revolution, Vietnam was raging on those years. People not going to college, worried to be drafted. Our schools integrated in Dalton within, I think, my sophomore year. So we were fully integrated. We all got along together, did fine together, but things were changing, certainly. I started to become more socially aware. So the Baptist Church then had a speaking contest, and nobody challenged me at First Baptist Church in Dalton. I won the speaking contest there, an association. Also won the speaking contest in Northwest Georgia in Rome. One of the judges happened to be my former debate coach, so I think he helped me, might have pushed me along. And I came to Tatnall Square Baptist Church to be part of a speaking and preaching contest at the church. Now, I'm not a preacher. I'm not a great speaker either, but I went to Tatnall Square Baptist Church socially aware. So also talking about religion, Jesus and everything, but really socially aware. I'm not sure how my talk went through at that time in a very conservative Baptist church, but that's my first talk really thinking about social awareness. When I was in med school, I did a summertime rotation with the Indian Health Service in White Earth, Minnesota. It's a Chippewa reservation, about 50 square miles. And talk about rural health and clinicians and chaplains. I never saw a chaplain, never saw a minister. Very poor, backward area. I did learn about Native Americans and read the book published in 1970 about Bury My Heart in Wounded Knee. I started learning more about social awareness for American Indians. Now, Duke in the mid-70s, I was a medical student. If you've ever been to the Duke campus, it's got Gothic architecture. I think it's based off of Princeton. I've never been to Princeton, but the medical school is embedded in the hospital. The hospital, of course, has gone well beyond. When I went for my last reunion, I could not believe it, of course, as usual. Hospitals, bigger, bigger, bigger. The med school's kind of embedded in the Gothic architecture, one end of the quadrangle. So for relief, we could walk out of the medical school, hospital, go out in the quadrangle, feel like a real person, be around students, you know. A block away is the Duke Gardens, which is beautiful. Go down there, get some relaxation, come back to the quad. I never saw a chaplain, never saw a minister in 4 years at Duke Medical School. If you go down the quadrangle a little bit, you come to the church. It's really like a Gothic cathedral, but it's the Duke Chapel. Huge. The steps away from the hospital. There's also Duke Divinity School, which is a Methodist divinity school. No chaplains I could see. They might have been there, but I never saw them in 4 years. On to Emory residency. First time I saw a chaplain there, I was a resident there, intern, in my first month at Grady Hospital, where I met Jim Hotz, Doc Hollywood. And I was on call, and back then we had no intensivists, so the interns and junior resident took care of people on the floor in the ICU. We had fellows come by help us out with respirators like pulmonologists and so forth. But I was on call that night, and one of my patients with acute pancreatitis, age 50, died. He was on a respirator. I think I've only lost one person since then with acute pancreatitis, but he was super sick. Now he's super busy. And many, many visitors up there when this person died at 50, everywhere in the ICU. I was doing the best I could, but had the presence of mind to think, ask a nurse, please call a chaplain. And Emory did staff chaplaincy at Grady Hospital. And I met my first chaplain at Emory that night, and I realized, unfortunately, I realized what they can do for me, but also for the people in the hospital too. It's kind of eye-opener. But after that time, I hardly ever saw a chaplain again through my 3 years at Emory, unfortunately. And of course, Emory is a Methodist school originally, has a Methodist divinity school right down the street from the hospital. Looking out from Grady, I was trained at Grady Hospital and the Emory and VA in Crawford Long back then. And you could look out across the hospital, across the interstate. I-75-85 was already there. Back then, you look out across the hospital from Grady and you saw what we called the projects. It was really apartments for people who are poor. That's been all over the place now by high-rises and so forth. But I sometimes look out across the interstate and think, will this circle ever be unbroken? Because even then, in a huge hospital, we see the same people over and over again at Emory, at Grady Hospital, come back, come back, come back, same clinics. That will ever happen. I learned more and more about social determinants of health. But March 11th, 2020, it was declared a global pandemic. We knew then it was serious. March 10th, Phoebe had its first case of COVID in the hospital. Turns out there were 2 African-American funerals the weekend after, right after the half marathon. And a pastor from Atlanta came down and performed at both funerals. He got sick while he was in Albany, was hospitalized at Phoebe Putney. If you recall back 4.5 years ago, testing supplies were very limited. CDC pretty much controlled it. First test CDC put out was not very good. Phoebe sent the person up to Emory Hospital, which is right down the street from the CDC. They got some supplies, testing supplies. The CDC tested him, and he tested positive for COVID. First case we had in Albany. March 11th, one day later, 3 more patients came in. They had all been to those funerals. Turns out the person who is a pastor from Atlanta had transmitted COVID unknowingly, of course, to 2 churches. And of course, in churches, people hug each other, console each other, very close together for hours. That's how COVID started in Albany. March 20th, a shelter-in-place order went in order in Albany. In a few weeks, the Phoebe Putney has about 400 beds, not counting some beds in an old HCA hospital they bought out about years ago, which is about a mile down the road. Other hospital had 2 rehab floors. Otherwise, it's pretty much administration. But Phoebe had about 400 beds at that time. With the 170 of them were COVID patients within a few weeks, almost half. We were overwhelmed with patients. We're the 4th highest per capita rate in the whole world, after Wuhan, China, New York City, Lombardy, Italy. Now, one of my friends, I love to play tennis, and we kept on playing tennis, for better or for worse, during spring and summer when we could. You kind of distance yourself playing tennis anyway. One of my friends I played doubles with ran a Chinese restaurant in East Albany. And it turned out he was from Wuhan, China. He'd gone back to see his family, just escaped in January of that year to get back to America. Otherwise, he would have been over there whole duration because China shut down totally. We had 15 to 20 admissions per day. It was all hands on deck, totally. The staff was overwhelmed, as you might imagine. Shortage of supplies, shortage of everything, again, costs going up and up and up. Everybody was distressed. The hospital usually had 3 ICUs, 1 surgical unit, 1 medical unit, 1 coronary care unit. They quickly turned the recovery room into an ICU. All elective admissions were canceled. All elective surgery was canceled. Surgical patients were dismissed as fast as they could be. Recovery room became an ICU, basically. The old hospital was renovated quickly to turn 2 floors that had been floors into medical floors again. The old ICU over there was also renovated, started up again. Governor Kemp actually provided funds to provide a hospital, very quick hospital built behind the other hospital, about 25 beds, put up in about 2 weeks by the National Guard. That was filled up, the hospital was filled up. ER kept patients in the ER on ventilators, which did not happen. We had people on the floors on ventilators, which did not happen. In the midst of all this, of course, to keep people safe, all the volunteers were sent home, all students were sent home. We had medical students from MCG, from PCOM, all went home. Which also meant all the volunteer chaplains went home, too. We had 2 chaplains back in those days. They had about 25, 30 chaplains who had some training, like was mentioned earlier, to help out the 2 chaplains. They all were sent home. And of course, all the ministers had the right to come and see their own people in the hospital, too, to see them. Nobody came in. The 2 chaplains were overwhelmed. That's all we had. We only have 1 chaplain now. 2 chaplains for all this going on. They had to cover both hospitals and minister not just to the patients, but also the staff who was overwhelmed. We started the command center. I never heard of the command center. It was put in the hospital boardroom 24/7. All branches met there. They communicated, of course, with the county commissioners, city commissioners, tried to have a coordinated response to everything going on, best they could. Talked about supplies, finances, distress, healthcare, personnel. Some personnel just could not keep going. They just felt too high risk to take this home to their family. They just left. They had to outsource trying to find nurses, traveling doctors across the whole country. And their prices went up too. Huge, huge expense to get somebody to come into Albany, Georgia especially, as an ICU nurse. Doctors came over from all over the country also. In fact, I still have 2 friends who came to Albany during that time, and I met them when I was doing ethics consults. They still come back and spend time as a traveling doctor, help out the ICUs in Albany 4.5 years later. They liked it so much. Not the COVID, but liked the experience and the way they were treated so well. They come back to Albany, take 2 weeks away, come back for 2 weeks, leave for 2 weeks, come back for 2 weeks, because they love the practice so much there in Albany. We started a clinical care committee. I was asked to be on that as an ethicist. I'm a clinician ethicist. And beneath that, we had a triage committee. And I've never used the word triage in a hospital before. Of course, we tried as hard as we could not to do that. But the ICU doctors, others were coming up with policies which were out of order with what we usually did. Ordinarily in a hospital, if you were on BiPAP 24/7, on BiPAP, you had to be in ICU. Nurses are too stressed out at night to take care of somebody on BiPAP 24/7. We changed that. People are on BiPAP on the floors 24/7. You had high flow oxygen going all the time. You had to be in ICU. Well, ICUs were filled. They were on the floors with high flow oxygen 24/7. We had to approve policies saying that was okay given what was going on. Dialysis. There's so much kidney failure and respiratory failure, but also kidney failure because of this is a systemic disease, COVID. They could not dialyze everybody adequately, so they went around doing dialysis 2 or 3 hours per patient. Not full dialysis, but just going to patient after patient, 2 or 3 hours per day, do dialysis. We approved a policy about that also because it was different. This all had to be discussed and discussed. We adopted our own policies. I got help from the CDC, from Emory, and Kathy Kinlaw, who heads their ethics consortium there. Haitian Center wrote up policies to guide us. These policies, scaringly, included how do you triage somebody off a ventilator to somebody else to be on a ventilator. Meantime, public health got involved, of course, too, as they do. I've been fortunately chairman of the Board of Health in Dougherty County for about 20 years. I'm very proud to say what public health did, too. Public health started as soon as we had testing supplies. They went to churches and got 4 churches in town to be a site for testing. We had testing 12 hours a day, 7 days a week at the health department. We set up a clinic ourselves in East Albany. Albany is a city that's pretty divided by the Flint River. The Flint River goes right through Albany. We had only practice, and still have the only practice on the east side of town there. We set up a vaccine clinic later, but also a testing center on the east side of Albany for testing with the help of the health department. Public health was stressed also. They have limited funds, limited shortage. They almost always run short of nurses because public health does not pay nurses what they can make in the hospital. They're always short. But public health, they did get some benefits, but they cannot make a cost. It's a calling like so many things, but public health stepped up also. But everybody really had moral distress, physical distress, psychological distress, moral distress. We have 2 chaplains trying to minister to everybody, all these patients, but also the staff, especially nurses, physicians too, though. Some physicians were so concerned about taking this home to their families, they just stayed in the hotel in Albany for over a month. Never went home. Just talked to their families at home. Never went home. So concerned about their children and their spouses. Some nurses just had to leave. The stress was tremendous. I'm sure the chaplains too were distressed by themselves doing all this and seeing so much suffering. And our chaplains quickly adapted also. They had to cover 2 hospitals now, bunches of ICUs. I can't even count how many ICUs we had. And the patients' families could not come in to see them for a while, for about 2 months there. They did FaceTime with the families, and families that take their tablets in the rooms in ICU. They dressed up themselves, N95 mask, all that stuff. Show the family, their patient, their loved one. If the family want to see this on a respirator, dialysis, whatever they want to see, if they don't want to see all that, just walked in the room, walked out of the room, and talked to the families at home, counseled them, mentioned to them, really by tablets and computers. It was all new for them too. So. And some families just didn't want that, but they were in the rooms, taking their own lives at risk also as our chaplains. It made a big difference when they could go into somebody's room and show families what was going on and how they were cared for, sometimes reassuring them, sometimes realizing how serious this was. But churches became a resource to be trusted. Quickly, the churches adopted too. All these small churches, we have lots of churches in Albany, out in the country. And I was amazed how they got on Zoom right away, and I do a lot of geriatrics. That's my specialty also. I started seeing people again after the clinic. These 80-year-olds learned how to Zoom in to their church service. Thought I might have to ask them how to do the computer sometimes, because probably much better than I am. But, of course, lots of times their daughters or sons helped them out, but still, they would sit at home, and some still Zoom in. I hate to say that some never went back to church again. So it became too easy, you know. Sit at home, have the TV going, and Zoom into your church service and say amen, whatever you want to, at home. Not the best thing for churches, but it does work, and you can Zoom in anywhere in the world. So. But it worked, and also the pastors were a trusted resource. And I can honestly say that I'm not aware of any disinformation. There's lots of disinformation in Albany, as it was everywhere, spring, summer, fall, about COVID, what it was, what it wasn't. They're a trusted resource, and the pastors, not only just a resource, but of course, helped out with moral distress, all kinds of distress for everybody as a resource. Now, our community is a very poor community overall. We have plenty of wealthy people too. We have a Procter & Gamble plant, we have a Miller Coors plant, we have a lot of industry, but also it's a very poor area. We rank actually 152 out of 159 counties in Georgia in health rankings. And like everybody else does, we have a high percentage of obesity, diabetes, hypertension. That's my practice. Kidney failure, renal failure, heart disease, high blood pressure, diabetes. That's adults primarily, and seniors. High percentage. So it's a high risk population for any virus, especially COVID. there's lots of death and dying going on. We had to work on our policies, as I mentioned earlier, adapt our policies. We have policies like all hospitals do on DNR, on withdrawal, withholding, life support, medical futility. I made sure our chaplain was on our triage committee at the table discussing all these things too. I can say once again, we never actually triaged somebody off of a ventilator to somebody else's ventilator. At one point, we came down to only one ventilator left in the hospital. Not occupied. I called our chief medical officer, who's one of my tennis buddies, friends, and he said there's only one ventilator left in the hospital. That time we had a 93-year-old person on the floor, very, very sick. And by this time, about 2 months later, one person in the family could come up to the floor to see their loved one. This person, 93, in distress, on the floor. I got a stat consult. I don't usually do stat consults. I'm a volunteer ethicist doing this stuff, but I rushed into the hospital, got to the floor, and the nurses are distressed, everybody distressed. Went in, gowned up, saw the patient, could not talk to me. She was high flow oxygen. Nurses are around her, intensivists around there. There's one daughter up there. They had talked to her, I talked to the one daughter. Of course, no advance directive. The intensivist really thought she should not be put on a ventilator. And I agreed. The Georgia law says for DNR, you should be either terminal, is futile, or be in a permanent comatose state. Our policy says the same thing, and I really thought this is a futile case, unfortunately. 93-year-old frail person with multiple risk factors, pneumonia from COVID, kidney failure, BU and creatinine high, to put on a ventilator, she'll never get off. It's not the way you want to see your 93-year-old person die. And I talked to the daughter, not about all the graphic stuff, but what do you really think she would want herself? She was willing to let her mother go, but she was on the phone with a sibling who was not up there, not from California, but from somewhere. We all said from California, but the sibling wanted everything done. She was not there. She was not there to see things. I'm certainly not going to lay blame, but the sibling was going back and forth with her sister up there in the room, outside the room, and finally the intensivist said, push the bed away from the wall, it's time to intubate. The last second, the daughter came in and said, don't do this, don't do this. Our chaplain was there helping out. Everybody's distressed, talking about moral distress. We only had one ventilator left at that time. We did not triage somebody off, but the daughter did the right thing. But we never had to triage anybody off a ventilator. I talked to Kathy Kinlaw at Emory about, you got a policy that says all this stuff, but how do you do this if it ever happens, you know? CDC had a policy also about this, but cannot see that ever happening. I learned all these lessons, of course: prepare, be transparent, educate, work together to build bridges. Fortunately, we had a lot of bridges with public health, churches. Triage, yes, we never had to ration, never happened. Collaborate, and all hands on deck. It really was all hands. Everybody was on deck doing things, our groups, hospital, community, everybody. Now come December 2020, we finally got a vaccine, of course. The first person in Albany to be vaccinated is Dr. Eddie Black, who's head of the emergency center at Peabody Hospital. He's on the Ethics Consortium board now, Eddie Black is. First person to be vaccinated in the community. We all started making appointments to get vaccinated. Almost everybody at Phoebe who wanted to be in community, people were vaccinated the first week. I got vaccinated the second day it was available. I would have been vaccinated the first day, but all the appointments were already taken. Then reached out to the community. The first people in the community to be vaccinated were 4 pastors in the community. They stepped up to be vaccinated. Quickly, by January, there were already rumors about vaccination. I hate to say that one of my friends I play tennis with, the traveling nurse, lives in Lee County. I think the world of him. Play tennis with him, but he's a traveling nurse. And that winter, I was talking to my friends about being vaccinated, and not been vaccinated, and he brought up, well, did you know about the 25 people around here who died from the vaccine? Well, he's my friend. I told him, I'm not aware of anybody dying from the vaccine. Those rumors spread. The churches were a great resource for what was true, not true, and encouraging their people to be vaccinated. I lost 3 people myself who died that first spring. and one person died the next year. She refused to be vaccinated. So I lost a total of 4 people the first 2 years. The person who died the second year had refused vaccination. She actually called us from the hospital when she had COVID, getting sicker, and asked could she be vaccinated. And we told her it's too late at that time. Unfortunately, she progressed and died. But there are a lot of rumors going around. The churches are a great resource. I bring this up because I got to go to El Salvador, India also, but El Salvador back in the 90s doing mission work down there. El Salvador was in a civil war for about 10, 11 years, and we went down there 1992, 3, and 4, right after the Civil War ended. It didn't get much done for our healthcare and religion, but I did learn about liberation theology, which says you must see something first, judge it, and act. Of course, that's what we do as clinicians. See, take responsibility, act. I felt like it's what we all did. The community stepped up. They saw this horrible tragedy. Nobody expected this. They took responsibility for this, and they acted. That's basically, I'm not a theologian, but to me that's what it means. See, act, and do something about it. And no one expects us to be pastors, but we ought to be clinicians doing this ourselves. I do want to say a couple more things about healthcare and so forth. I did go to Davidson College, and just want to say is, like Mercer, Davidson is a college, not a university, but I think for the students going to liberal arts education, taking philosophy, taking ethics, taking things besides organic chemistry, which I actually liked. My organic chemistry teacher was an incredible person. He became the governor of North Carolina a few years later. He's a very smart person. To teaching organic chemistry, all that stuff too, but just taking humanities, philosophy, ethics, psychology, all that stuff really lays your background for your whole career. I don't regret one bit taking all those courses. I had to take all the sciences and the MCAT to get into school, but all those courses have helped me my whole life in terms of how you treat people, how you see the world, and the whole world. Albany is just a part of the world, but I've been able to travel around the world doing things and put a plug in for Mercer and this undergraduate program too, and liberal arts in general. Emory has, of course, has the same type thing, but Davidson gave me a wonderful experience. Very small school, 1,000 students back then, very close to my professors, but learning so much about how to be a clinician later on. In summary, I feel very honored to be invited to speak here today and share with you my experience. I'll talk a lot more about just about COVID, but I have to kind of where I've come from. I've been very fortunate to work where I do work. I feel like we're in the trenches in Albany, Georgia, still in the trenches. We started our first clinic there in '79 in Lee County, Baker County, second clinic. We still have the only clinic in East Albany 45 years later. We work with the hospital a lot, others very, very much also, but just being part of this consortium and this symposium, whatever you call it, it's been great for me too. But I do appreciate all the work you all do too. And rural health care is in my blood too. I grew up in Dalton, a small town, live in Albany. We go out in small communities, and I think rural health care will be here now, the future. It's getting stronger because of a lot of work that you do. I know Gene Sumner from years ago. I used to be a medical director for a nursing home in Leesburg. That's where I first met Gene Sumner. She's a very down-to-earth, practical person herself. And I think she's a great dean leader for you all too. So I appreciate being invited and look forward to more discussion. Also look forward to learning more about your programs here. One of our board members for Board of Health is a county commissioner. He's been up here several times. Russell Gray, been to meetings here, but I look forward to learning more from you all too. Thank you.
Dr. Scoggins, I so appreciate your words to us today. I think we have a few more minutes. Does anyone have any questions? I can't help but draw parallels to the COVID crisis and what you have said you learned about faith and health working together, and to what we see unfolding in North Carolina and in rural places in Georgia, Tennessee, with this hurricane and think that we are, I mean, there are a lot of people who are not here today who wanted to be here, but who are doing the work in their rural communities. So I wonder, is there any questions for Dr. Scoggins or anything that we would like to, anyone have any thoughts around that before we take our break? Yes, yes, ma'am, hold on.
I just have two things that I would like to share. When Dr. Scoggins, is it Scoggins? When he spoke about the episode, the epicenter in Albany of COVID, prior to that happening, my sister was visiting that area for like a church conference. She came home she lived in Florida. She came home from the conference, and just like he said, nobody was using any mask or, nobody knew what was really going on. She got back to Lake West, Florida. She was so ill, she almost died. They would not give her any testing for COVID. She was so sick, she said like her kidney felt like it was going to come out of her, just organs were on fire. She wasn't tested, and she was very, very ill, and she just, prayerfully, she made it through. But she had COVID. It was not diagnosed, she didn't get tested, but she had COVID. And at the time, I think she was about 62 or 61. She was in her 60s. Then another incident that he mentioned was about the hospitals in Dawson and Cuthbert. I'm a nurse practitioner, but at that time, I was traveling with an agency to those various hospitals in those rural counties or rural areas. And the care was just, it was marginal. Reason being was the fact that by the time, you had a traveling nurse come to your hospital, and I usually worked in the ICU, the patients were so ill because they had not received any primary care for how many decades. So they were almost dead by the time they got to us. And now I understand, like Dr. Scoggins mentioned, these hospitals are closed. And that was in the 90s that I was a traveling nurse, and I live in Columbus, Georgia, and we worked for an agency, and we went around. So just thinking about the picture of what happened and relating to those two incidents that were a part of my life, I just wanted to share that.
Thank you, thank you. And I think we're still processing what COVID meant to us and how that plays out in moving forward, right? How can we make a difference there? Are there other, and if you share, please start by sharing your names and your contacts. No, I just thought of that myself, actually. Thanks.
I'm Debbie Weaver, and I lived over at Lake Seminole when Michael came through. So when you talked about how people come together through a disaster, our faith communities helped that lake community, which was cut off from the county seat. Although the county seat didn't realize that. They kept saying, oh, those people from the lake can come get their help here. Nope, there's no road between here and there. So from that perspective, my heart goes out to all those communities that are impacted by this hurricane. But my husband and I both got COVID before we knew it was COVID. We went on a cruise in early November. And of course, cruise ships now we know are incubators for any disease. But we came back and both of us were so ill. And he had underlying COPD from his Navy and his work with the Air Force. So when he got sick, it exacerbated his COPD. He went from level 2 to level 4 very quickly. I was a tremendous advocate for the vaccine when it came out. However, I'm one of those that, and my husband died from COVID in February before the world shut down. I'm one of those recipients of a pacemaker because COVID wiped out my AV node and my SA node. So thank God we have pacemakers that do more now than just set your rate, because I'm real sensitive to how fast my heart goes. My vagal nerve makes me pass out at 120. So I never get to that speed now. But the underlying long-term effects of COVID, I think we're not going to know for many, many years, and then add to it the vaccine. Both of my cardiologists have said, yes, this is related to you having COVID 3 times, and vaccinations even before you had it second and third time. So that to me makes it even more important to figure in making sure that we talk to these people about long-term effects and spirituality as that occurs, because it can be devastating.
The two affect one another. Thank you very much. Any questions for Dr. Scoggins as we move forward?
Thank you. Feels weird to use a microphone. Well, I wondered if you could reflect a little bit on the role of the chaplains in providing care for practitioners, I mean for clinicians, and you mentioned moral distress. You also said many of the chaplains weren't available because they're voluntary, so what did that look like in your context?
Of course, primarily one-to-one meeting with the nurses and physicians, and there's a chapel in the hospital, like most hospitals, but they didn't have meetings in the chapel for a while because they didn't have people coming in unnecessarily close together. But it's mostly one-on-one and counseling and so forth too. I talked to so many nurses who just had somebody to talk to. They were a resource to talk to. You have 2 chaplains covering a 400-bed hospital, which quickly became a 500-bed hospital. And so much staff, thousands of staff, they couldn't cover everybody. So it was triage. There was triage for that, certainly. That's going on still. The chaplains themselves need chaplains. I mean, one of our chaplains, after about a year later, left, went to Savannah. He's in Savannah now. And I knew him pretty well, but he always came out to the marathon and 10 marathons because one of his relatives ran the marathon, half marathon. He'd been an ex-military chaplain. But he was just, not because of Albany or Phoebe, just so stressed out, like I said, he just needed a different scenery too. So chaplains need chaplains too, or ministers too. So just as much as the nurses do too. A lot of people just didn't get help either. They got it from somewhere else, or outside the hospital, because they were overwhelmed. And many nurses just quit, moved on. Also, I can't blame them either. Many staff also, physicians too, also moved on. So.
We maybe have time for one more question. Do we have any other? Yes, sir. And please do introduce yourself.
Hi, everyone. My name is Adi. I'm an undergraduate student here at Mercer. But my question is, so do you see the role of chaplains or just religion in healthcare in general? Do you see that as more of something to increase patient outcomes, or something to just make a patient feel more comfortable, or to lead them through end-of-life care, or just help them come to terms with what's going on in their lives?
I have to say, I'm unfortunately not aware of outcomes research right now. I should know that. Definitely in terms of well-being, makes a difference. Well-being is just as important. It's part of the outcome is your well-being too, spiritually and physically too. Our statistics, and so I can't really tell you that myself. And that makes a difference in how they feel, how they cope. You saw our community rankings up there. There's a lot of stress in the community just from living there. Certainly not everybody, but a lot of my patients at the community health center are poor, illiterate, come in, lots and lots of problems. Housing's a problem, crime's a problem. So they can certainly help with those kind of things. And I think long term, hopefully, this health project here, this role project here will help determine ways to improve it also. Maybe not my career, but your career. Seriously, how we can do more in the community to improve outcomes, or at least prove that's possible. Certainly, outcomes in terms of the way that people feel, support and so forth. makes a difference. And religion is very important in Southwest Georgia, just like it is out here. Very important. Almost all my patients go to church somewhere. Maybe on Zoom now. They go to church somewhere. And it's very important to their lives, much more than it is I know. So it's having that kind of background too. So I look forward to what you all can accomplish in your careers, take it to another level. I've challenged you the best I could. I minister at First Methodist Church in Albany. He's a great minister. I think he's more worth this to the Methodist Church, but it's just important day to day too. And for us too, I've learned to kind of not so much spiritual seeking, but just needing help myself and talking to people. There's a tremendous amount of stress from all this going on. Seeing people die.
I can't overstate how much I like that question. Is this about comfort or is there outcomes? And if we can have a summit, maybe that's one of the questions that are great to have our break with and for you to take and have among yourself. So we are running a little bit early, and that's good because it's Friday. So why don't we come back at 1:45 and get ready for our next speaker. Until then, please, if there's anything left on the buffet, you may have it. Lunch is going to be great, by the way. And take a little break, and we'll be back right at 1:45. Thank you very much.